So we're actually talking about surgical rehabilitation that most moms know nothing about, but they really should be doing something about it. And so, therefore, a lot of moms get a C section shelf, but it could have been prevented, air quotes, prevented. That swelling should have been dealt with.
Are you a doula that wants to grow and scale your business? Well, the good news is I'm finally launching something that you guys have asked me for years. You guys have been begging me to create a program to help you scale and grow your existing business, and I'm doing just that. On May 5th, our class launches for our Business Accelerator for doulas. You should be a doula who has already taken 1 to 2 clients a month, but you are craving more, and I'm going to teach you exactly how to do that. This is an 8-week small group coaching program, 6 weeks of group coaching, and then 2 weeks of one-to-one coaching calls with me and a business mentor, and we are going to dive deep into your business to help you soar. We're going to be covering everything you need to know to absolutely blow up your business. We're talking scaling your offers, nailing down your pricing, securing additional clients, growing on social media, navigating hospital policy and tricky situations with clients, plus improving your practice as a doula. You are going to go from grinding and wondering if you nailed that last client interview to absolutely being confident in taking claim as the it doula in your area. People are going to be knocking down your door to work with you. I launched my business back in 2016, and I now bring in over $500,000 each year in revenue. I have 3 online courses. I've launched the Birth Lounge membership that has had thousands of women go through it. I have an app. I've launched more than 20 online products that bring me passive income every single day, 300,000 followers on social media platforms, and a podcast with over 350,000 listeners. And most recently, I've started to dabble in brand partnerships, which brings me thousands of dollars each month. I want to teach you how you can do this too. I want to help you craft what you want your business to look like. If you don't want to be taking on 5 and 6 births a month, then don't. Let's create an online program that can put passive income into your pocket every single month where you get to spend more time with your family. If you're ready to niche down and only take a few clients a month, but you are ready to launch an online product that can help you make income in your sleep, let me show you how to do that. If you've been struggling to grow on social media, I have the recipes for going viral, and I want to teach them to you. There's an application in the show notes. This program is limited to just 10 spots. Class starts on May 5th. We will be doing discovery calls to make sure that the people who get into the program are the right fit, because I want to make sure that everyone in this program is not only successful, but you can actually grow your business. Visit the link in the show notes to apply today. And if you have additional questions, find me on social media at Tranquility by HeHe. Drop into my DMs, and I can let you know if you are the right fit for our Doula Business Accelerator. I literally cannot wait to share this with you guys. Bye. Hello, and welcome back to another episode of the Birth Lounge podcast. All right, did you know that April was C-Section Awareness Month? I usually do a huge type of kind of series, or I usually just pay a lot of attention to C-Section Awareness Month in April, but I have recently, over the past year, been given so much attention to C-section prevention that I didn't necessarily feel the need to focus an entire month on it because it has really taken on a personality of its own within my brand. Last year, in year 2024, our team had only 3 unplanned, unexpected C-sections. We had a less than 5% C-section rate among all of our clients. And so I feel like because I do so much work in preventing C-sections, I didn't necessarily need to spend a whole month focused on it. However, what I did want to bring you is a topic that I've never talked about before on the podcast. Now, today we're diving into a part of C-section recovery that no one really talks about, but so many people struggle with. And that's the C-section shelf. And I know that you know what I'm talking about. It's that stubborn pouch or flap of skin and scar tissue that hangs differently over your scar post-surgery and makes you wonder if your body is ever going to feel like yours again. If you have been feeling frustrated or caught off guard by the way that your body is healing, or even maybe a little betrayed because no one warned you that this might be part of C-section recovery, then listen up, because today we're going to be unpacking what a shelf is, why it happens, what's going on anatomically, what's normal, and what options you have in not only preventing it after a C-section, but also healing it if you find that you have one. From scar massage to fascia work to strengthening strategies and supportive garments, we are going to cover all of your options. I'm so excited to be being joined by Janette Yee, who you might know from social media as Ask Janette. Now, she's a perinatal athletic therapist whose goal is to completely redefine the current state of public C-section healthcare. She treats pregnancy like the ultimate endurance sport and C-section like a season-ending injury, in which recovery is totally possible, absolutely safe, and quite simple. Janette has over 20 years as a manual therapist and exercise professional, and now she provides her one-to-one services for women who are healing from a C-section. C-section recovery is not only physical, and we touch on the emotional and mental aspect of healing from a cesarean as well. I want to remind you that your body is not broken or ruined. Recovery from this major abdominal surgery is completely possible. And you spent so long growing a human, and I want to remind you that that deserves compassion, not pressure. So whether you're weeks, months, or years out from your C-section, this episode is going to be a total game changer for you. Without further ado, Janette, welcome to the show.
Oh my gosh, thank you so much for having me here. It's been a long time coming.
It has been a long time coming, and I'm so glad to finally have you on here and to talk about such an important topic that I think A, doesn't get a lot of light, B, is very unexpected for our C-section mamas, and C, it feels once it happens to you, people don't know how to get rid of a C-section shelf. Where do you turn for the information? And there's a lot of big feelings that are connected with it: shame and guilt and embarrassment, and people just really want to get rid of it, but they don't know how and they don't know where to find the information. So you are our it gal. I'm so excited to be diving into this conversation. But before we dive too far into C-section shelf, I think it might be helpful for us to understand two things. What are
Okay.
all the layers that we're going through with a C-section, and how in general does our body heal from a C-section? And then we can dive into how a shelf actually develops.
Okay. I'm just going to give this all context. I'll be talking about C-sections or cesarean births and C-section shelves from an experience of a therapist.
Yeah.
So these are, I'm going to be telling you, so not as a researcher is what I mean. So I don't want people to think, oh, Janette does like C-section surgeries, whatever. She sees them all the time. So I don't. And as a matter of fact, the majority of folks that I help from a therapy standpoint is virtual.
Oh,
So
yeah.
keep that in mind to all the listeners here. So, folks, the healing potential without a therapist like myself even touching you is massive, massive. You actually can heal yourself in ways that no one's ever shown you. You had no idea. So I really wanted just to give that context today's talk so that people don't think, oh, that's really nice. Now I have to like work with Janette and see a therapist in my local area, and there isn't one. Okay, so let's start with that. Let's start with that. Okay, so your first question was what? How many layers get cut through? So there are, on a macro scale, 7 layers that are cut through. And this is not the same as 7 cuts. There are 7 layers that are cut through from your skin and your fat all the way down through to your uterus. 7 layers. They're all different types of tissues. And that's important because every tissue does different things. But what I really want to talk about is how many cuts are made. So if there's 7 layers, do they all receive their own cut? The answer is no. And do each of these layers get stitched back together on their own so they heal separately-ish, but also together? The answer is no.
Wow.
So Haley, can I actually show everybody what the surgery looks like?
Yeah, of course. Go for it.
Let's do it, because I brought my trusty washable marker and my daughter's washable marker here, and I brought my tummy. I want to make sure everybody can see. So I'm going to, this is on video too, but I'll also walk everybody through from an audio standpoint. So I'm standing here with my belly exposed from my sternum all the way down as close to my pubic bone as video will let me, as Instagram might let me. But okay, so your first cut, first of all, I want everybody just to think for a second. How many cuts do you think are made in the surgery? Just keep that number to yourselves. Everybody think of it. Haley, don't even answer. It's totally fine. I'll just tell everybody what I thought as a therapist, having gone through therapy school. I thought there was one, because
Um,
that's what you see. You could see one major incision from the outside, and that's wrong. So I'm going to show everybody that there's not one cut. Okay, in the surgery, there's more than one. So here it is. The first cut is going to be somewhere close to the pubic bone. Okay, it's usually horizontal. Here in North America, where Haley and I are, it's usually horizontal. Hysterectomies are different. Myomectomies might be vertical, but for the most part, a cesarean is horizontal. That goes through skin and fat only. Skin and fat, so 1, 2 layers. Now, here's the wow factor that I didn't know. Second incision is made somewhere between that first one and your belly button. And it's also horizontal. It's a little high, Haley. Again, I can't really pull this right down here. But friends, there's actually a second horizontal incision in what folks often call their C-section shelf or their overhang or their mummy tummy. That flap that hangs over that external incision oftentimes remains sore for months and months after the external one isn't sore anymore. And everyone's, what the heck is that? Why is it so sore? And that is the incision through something called the myofascia. And myofascia, for the listeners, is just a fancy word to say the very powerful connective tissue that covers your muscle. So it's not even your muscle layer, but it's very thin. And so folks are like, what's a fascia? Think of if anyone's cut through an onion before. You cut an onion and you open it up, but it's got layers. But in between each layer, it's got that thin piece of skin. That's essentially what fascia is. It's like a connective tissue. It's almost that thin, but it's so powerful that the surgeon has to cut through it with the scalpel. Okay. That's layer 3.
but only our second cut.
But only our second cut. Third cut, vertical. Third cut is vertical right through the linea alba, which is a tendon that holds together our entire muscular wall. So it's a tendon, so it's not muscle. But a lot of folks are told, no, your muscles don't get cut through and you're cesarean. And a lot of moms then erroneously hear, my muscles aren't cut, so my muscles don't need rehabilitation. I'll be strong, I'll be fine. Except that is that's not accurate, right? Because she wasn't given accurate information. It was accurate, but it wasn't what was supposed to be received. This vertical line holds together your entire muscles. And this is so thin. It's your diastasis, by the way. It's your diastasis. It's stretched so thin in a full-term pregnancy that a finger, the surgeon's finger, can just split it open like butter. It doesn't require a scalpel. That's how thin that layer is. It's literally blunt incision. Okay. So now your diastasis is cut open. So now that's 1, 2, 3 cuts, 4 layers. Now your abdominals, your muscles get open like a curtain. Now you've got peritoneum, which is actually, you've got more fat. You've got fat that protects everything. Okay, that's moved aside. Peritoneum, that's moved aside. That didn't even cut. It's got shoved aside, shoved aside. So that's layers. Oh my gosh, what is that? 5, 6. Then you've got your uterus. Full-term uterus is this big. Haley knows. It's huge. It's huge. And that gets its own cut. It's a thick, powerful muscle. The uterus is so powerful. It's got like the uterus, you got to work hard at cutting it open. And that's usually horizontal too. That is pried open. Then your baby is birthed. Immediately, your uterus shrinks right down. Okay, here's another interesting fact. Your uterus is stitched together. Your linea alba is not. It's just left. Your myofascial incision is not. That's just left. And then your external incision that most people see either get staples or stitches or subcutaneous stitches, dissolving staples, glue, steri strips. It's up to the surgeon. But all we see is that one. And then we go, okay, 6 weeks later, I don't hurt anymore, so I'm fine. Folks, I hope you just envisioned, if you couldn't see, envisioned just how aggressively major this surgery is. And the last visual I want everyone to see is if I stood sideways, where's my uterus? It's right in the middle of my body. That's how deep it is. I am my body size. That is 4 inches from the outside into my inside. That's 4 inches of scar tissue. That's a lot of scar tissue.
Wow. Okay. I guess when you said think about the number of cuts, my guess was 4.
Okay.
That is really shocking. Tell us why our linea alba is not stitched back together. Why do we just leave it? And do you think that kind of adds to diastasis recti? Would we see people having less cases of DR if we would stitch their linea alba back together?
Honestly, your reaction was exactly mine when the doctor first told me. I was like, did they? Why? What? Again, I'm a therapist. I'm not a surgeon. So to answer your question, just strictly like black and white, the surgery research, medical research shows that there is no significant difference in postpartum recovery of a linea alba that is sutured versus if it is not. But I don't know what that measuring rod was, what insignificant difference of postpartum recovery means. I don't know if they asked any therapists who have worked with thousands of C-section moms. I don't know how many C-section moms they asked. Maybe they didn't ask anybody. Maybe the test was, does it still hurt at 6 weeks? I don't know what the defining answer was.
Yeah.
But it was enough of a piece of research that now it is uncommonly practiced in North America by surgeons that the linea alba is not stitched back together. And to be fair, from what I understand talking to surgeons, is that the linea alba is so thin that on, let's say, repeat surgeries, on, let's say, a mom who is deconditioned, so her linea alba is already pretty thin, it's tough to stitch back together is the point. It's tough. So if there isn't much to stitch together and that's going to take a longer time, what's the risk of infection? Well, I'm sure there are a lot of other variables that you and I aren't aware of that informs that decision. That being said, I know moms who have gone into folks who are having planned cesareans, having that conversation with their surgeons pre-surgery. I would like to know if it's possible to stitch up my diastasis. What do you think? And it has happened. Surgeons, sure, we're having a planned cesarean. It's a much cleaner, calm surgery. The chances of rehabilitation are much better versus an emergency surgery where a woman might have labored for hours, even days. She's so exhausted, the muscles are so depleted, and then she gets an emergency surgery. The recovery on those tissues are already challenged, right? To receive, who knows? So it's happened. Folks have requested diastasis to be stitched back together, and it is stitched. Now,
Yeah.
the second part to your question, does it change the outcome? I'm no researcher, but if the muscles are closer together and you train them, I'm going to say it's probably got a better outcome with the exact same protocol.
Yeah. It
Just
just
saying.
logistically makes sense, right? It just,
It just, right, right. Which is also, what if, Janette, somebody used a compression garment sooner than later? Does she have a better outcome? The answer is yeah, she
okay.
does.
All right.
For a lot of different reasons, not just the muscles are maybe more approximated, she might feel safer or what have you, but there's a lot of reasons why. Does it heal better when a mom starts with diastasis rehab exercises from day one? The answer is yes.
Yeah. And you're
Right.
talking about belly bands, belly binders. Is that right?
That's right. So, two specific things that I'd be talking about are, I know I'm off screen. Now we're going totally rogue, Haley. We've got abdominal wraps, and folks know abdominal wraps is something you just wrap around your abdominals. It could be a single piece, oftentimes a Velcro. It can be tied, right? So there's a lot of cultural belly wraps that are just beautiful. And it's part of the culture that somebody might be bound up. It's something like this. It could be a double wrap. It could be a singular Velcro. This one happens to be two. The other type of abdominal compression or wrap, my favorite, is a compression garment. So these
Oh,
happen to be shorts,
okay.
but the shorts go up to my sternum because that's the top of my ab muscles.
Ah,
So this entire, it's like super high-waisted shorts. And the high-waisted part is very compressive. It's tight. I'm trying to show everybody here. It's hard, it's tough to pull apart. So it's compressive, but it's like a nice hug.
nice. Okay, and when are we starting to wear that? Like day one, day of discharge, 2 weeks postpartum?
Yeah, this is a good question. Going back to our initial question, which is C-section shelf, what is it? A big part of that shelf-like appearance after cesarean, where the tissues above and below that external incision bulge past it, that's what I'm referring to as a C-section shelf, Haley. There is actually no real term for it. Isn't that strange? What do you Google? What do you search for? If there's no word for something that basically every mom gets after a cesarean, how does she get help?
Yeah.
Right?
That's what I
Right?
was
Isn't
going to say,
that
though. It's
weird?
funny that there may not be a word for it, but every single person who's had a C-section knew exactly what you were saying when you said that term.
Yeah, I know. And it's not even, I don't even like that term. I don't want to
Yeah.
call my belly a shelf, but literally, so many moms were like, this is, I don't know, what do you call it? An overhang? The
Mm,
belly flap? My gosh, I wish there was something more empowering to call it, or just straight up neutral.
yeah.
Anyway, I digress. This is a philosophical discussion at this point. But the C-section shelf, Haley, is something. I know we started this talk by saying, wait, everyone's looking at how to get rid of the C-section shelf and all this kind of stuff. So I don't want to have moms listening going, oh, I can get rid of it. Getting rid of it is something like it's a promise of something. It's like you're guaranteed to get your pre-baby body back. It's a inaccurate promise. But what I want people to understand is that C-section shelf-like appearance is caused by surgery, meaning from days 0 to week 6, it is caused by a ton of swelling, a ton of swelling. So we're actually talking about surgical rehabilitation that most moms know nothing about, but they really should be doing something about it. And so, therefore, a lot of moms get a C section shelf, but it could have been prevented, air quotes, prevented. That swelling should have been dealt with, for example, with a compression garment or a compression wrap. So going back to your last question, when do we start wearing this stuff? If you want to minimize your C-section shelf slash, if you're going to do rehab properly after a surgery, you get rid of the swelling on day one. Day one. So it's whatever would work. So think about if you sprained your ankle horrifically and it's like swelling like a massive and you can't even see your ankle anymore. It's the size of your calf. You're not just going to leave it for 6 weeks and do nothing, which is what a lot of moms basically are told to do after cesarean. I think even instinctively, Haley, we try to wrap it with something, or we hold it at least because it hurts so damn much. That's what compression is. So you start on day one, or as close to day one as possible. And there are a lot of different types of solutions. I personally, when I work with moms, I talk to them about, listen, that compression garment's going to be a heck of a time to put on because it is tight. And you're going to have so much swelling from the surgery alone, not even from the injury, because of the medication, that you have extra swelling. And then in the first 2 weeks, that swelling like aggressively decreases day by day. Meaning for the first 2 weeks, you're going to need something a little bigger so that by the first, after week one, week two, this becomes a proper fit.
Okay.
And because this wouldn't fit in week one, week two. For most folks, not for everybody. Everybody's different. But for most folks, 80% of folks are not able to pull something like this on, even if it fits their skeletal system properly. It's just too much spine.
Yeah. Okay. And are you worried with the compression wear about any sort of additional downward pressure on the pelvic floor?
Yes.
Okay.
Oh, great question. Yes. Yes. Because right away, Haley, let's be real. I know there are probably 90% of the moms listening to this, like, I'm going to wrap this thing as tight as I can. I'm
Yeah.
getting rid of my C-section shelf.
Yeah, that's what I
Like,
imagine. I'm like, no,
of
we need a
course.
little bit of caution.
For sure. And to all the listeners, actually, I want to ask you, Haley, what was your worst ever musculoskeletal injury? Did you break anything?
Honestly, I've been very lucky. I have not really ever been injured too much. I played sports growing up, so I've had a torn meniscus. I fell down some stairs once carrying a big box. I did break my fifth metatarsal 4 years ago, so it was painful, but the recovery was short and quick and easy. So I'm really lucky that I have not had too many injuries and certainly nothing that required extensive rehab. I've never been
Mm.
a knife or needed surgery for anything like that. So I'm really lucky in that regard.
Even with a fifth metatarsal fracture, even if it's just a fifth metatarsal fracture, think back on day one when it was like big.
Hurts so bad. And my foot was so swollen.
And you're like, oh, it's just a little fracture. And it was just
Yeah.
compared to the other fractures, you like break your
Yeah.
femur and half of your humerus. It's a totally different, it's just a little fracture. But
Yeah.
think of that amount of swelling, Haley, in your foot.
Yeah.
What would have happened if you wrap that foot as tight as possible? Would it be helpful or would it hurt like crazy?
Yeah, I assumed it would have hurt. I did a lot of just Epsom salt soaks and I did arnica, and I thought
Oh,
that
so
the
you didn't
hospital
wrap it.
system would know. I didn't wrap it. I didn't know. And you know what?
Oh.
I was actually unable to find any guidance with any orthos in the Boston area, and they couldn't get me in for more than 2 weeks. So I had 2 weeks of
No. After a bone
unsupported
fracture?
broken bone.
No.
Yeah.
See, I'm angry for you. Next time, just call me. You have my bat line. Just call me. Because I did orthopedics for 20 years before this, right?
Oh, yeah.
Like sports orthopedics, listen, and a little bit off topic here, but cesarean is probably one of the most intense injuries any body would ever sustain. Childbirth, let's call it childbirth, whether it's a cesarean or a vaginal birth. It's an injury. It doesn't matter if it's natural to get pregnant. Childbirth is very physically traumatic. That
Sure.
requires intentional rehabilitation. And in my work with a lot of female athletes, after I quit the scene of on-field care and sports teams care, and when they started families, literally I was having women who sprinted for Canada, played rugby for Canada, international, like full contact sports, go, my childbirth was the worst injury I've ever experienced because it's your very core.
Wow.
It's almost like I tore my knee meniscus. You almost understand. I know it's going to hurt heck for X amount of times, and I know I'm going to need crutches and it's going to suck, but you almost have a context of how bad it's going to be in a weird way because you're prepared mentally. A
Mm.
cesarean? What have you got to compare with that? Who's ever cut their abs open by accident? The
Yeah.
same way we'd sprain an ankle by accident. No
Yeah.
one has that context. When we think of, oh my gosh, swelling, oftentimes Haley's an outlier. She didn't wrap her ankles hard as she could. That's okay. That's okay. A lot of folks might see, holy cow, it's huge. So I'm just going to wrap it really tight. So a lot of moms might look at their abs and be like, oh my God, it's so swollen. I should probably wrap this. And now that everyone's hearing, they're going to wrap it real tight. But what happens is this. What happens is this is the glory of living at home with children because you got balloons lying around. But if this is your swollen belly and you wrap it really tight, and here's your breathing muscle, your diaphragm, and here's your pelvic floor at the bottom.
Just
Folks who are
display.
watching this, if I wrap my abs super tight, it's really hard to breathe. And my pelvic floor is busting right down.
Yeah.
And even if you didn't have a vaginal birth, pregnancy alone impacts the pelvic floor and challenges it so that it's weakened by an average of 25%. That's by
Wow.
research, by the way. Okay, by pregnancy alone, your pelvic floor is weakened by 25% because literally it's been working out for 9 months. So if you squeeze the junk out of your abdominals because it needs compression because it's swollen, that's right. If you squeeze it too hard, it's going to hurt your pelvic floor. You're just going to get a pelvic floor injury, or you get acute pelvic floor symptoms like prolapse, which feels like a tampon. You put it in the wrong. So it's kind of something's bulging or hanging out of you. It's uncomfortable, or just like heaviness between your legs. It doesn't hurt necessarily, but that's your pelvic floor going, Haley, don't feel so good.
Something's not right.
And something's not right. So it's too tight. So you're going to have to loosen up that wrap, even though in your head you're like, tighter the better. It's not.
Mm,
Actually, less tight is better.
mm.
You'll have a much better outcome if you wrap it just so. You'll know it's right because it feels better everywhere, not just here. It doesn't hurt anymore. Okay. And if it's too tight, you just loosen it up a little bit, especially after you eat, especially if you sit down, because when you sit, things widen up a bit.
So you're
Yeah.
going for adequate support, but not discomfort. You don't want to make it
Yes.
hard to breathe. You don't want your pelvic floor to be taken on additional tension. It's more about supporting those muscles, tendons, fascia, fat, skin that was cut through during your cesarean.
If you go to the research, you're going to find that actually doesn't happen.
Hmm.
What compression does is it controls the swelling.
Hmm.
It doesn't provide physical support because there's no rigid stays that take the brunt of all the tissues. But one absolutely experiences a sensation of being supported. Any mom listening to this who's wearing a compression garment or whatever and they need it, they'll be instantaneously be like, oh, I feel so much better. It's almost tough to describe. It doesn't feel like, oh, my fascia feels more supported or my abdominals feel more rested, but it just feels supported. There's no other word for it. But from a mechanical standpoint, nothing is being supported because there's no rigid physical stays. But the swelling, C-section shelf, step number one, swelling is the number one cause in those first 6 weeks. The faster you can get that swelling out of there, aesthetically, the side effect is wow, that shelf really got minimized. But from a healing standpoint, again, from a therapist standpoint, I need that swelling out of there ASAP because swelling impedes healing.
Hmm.
I'm going to say that again for the listeners. Swelling prevents healing from happening. And until that swelling can get out of there, you can't really get really great, healthy, oxygenated blood into the areas that need the oxygen to heal and grow back and grow stronger and all of those things.
So the
So
swelling
we
kind of
really
keeps
want it falling
things
out.
stagnant, is what you're saying. It
Oh,
doesn't
yeah,
allow the healing to happen because things can't be moving through it.
exactly. Exactly. And that's why folks who are even like months postpartum feel, I can't even describe it, their bellies are heavy. It doesn't
Hmm.
hurt anymore. It's not, they can't actually say, I feel swollen because it doesn't feel that way. It just feels like heavy. Like it's not normal. They might exercise, but it's just doesn't feel right. And then when I actually physically put my hands on them and move the scar tissue around and get the fascia going, the sensation of lightness is almost immediate. Like within one treatment, they will feel, and it's not like I changed the scar tissue. You can't change scar tissue in 20 minutes, but you absolutely can change swelling in that amount of time.
Okay, so how long are we wearing the belly bands and this compression wear? If we start it as soon as possible, how long are we wearing it?
For sure, for the first 4 to 6 weeks.
Okay.
And easily like 24/7. So even when
Okay.
you sleep, mamas, even when you sleep, because when you're waking up in the middle of the night, you sit up out of bed, your abs, you got to contract, and then you're picking up your baby. You got to bend over, you got to support your abs. You're holding, I don't know how many pounds your baby weighs, but you're not just holding for a split second and then they're gone. You're holding them, who knows, sometimes for hours. My goodness. Your abs are working so hard. Some babies need to be rocked. And even if you're sitting there, you still have a baby sitting on you. Maybe you're holding them, maybe you're learning how to nurse, and that's awkward. And you got to, it's work. So you
Yeah.
need compression, which is it's almost like a brace.
Sure. That's
It's almost
exactly
like
what
a
I'm
brace.
picturing. Yeah.
Yeah. So you wear it overnight too. And that's why this is so much more comfortable than a wrap. You could sleep in a compression garment. It's bulky in a wrap. So I always recommend a compression garment. I like this particular brand. I'm sure there are others on the market, but this one also has a pelvic floor support.
Mhm.
So this is the only thing that I put my name behind.
Okay.
Other things could work. I just don't know about them.
In addition to the compression wear, what other things are we doing to help prevent the C-section shelf?
Okay, great question. I want to back it up and almost ask a better question, which is what causes
Hmm.
the C-section shelf? Because the cause of the shelf is different as the weeks and months and years go on,
Wow.
which
Okay.
means what you do for it is different depending on how many days or weeks or months or years you are since your surgery. So if we talk about the first 6 weeks, it's compression for sure. But you also have scar tissue, which is forming, and you really want it to not form stuck or tight. I think a lot of moms feel, and rightfully, really leery about movement. What if I hurt myself? You want me to touch my scar? Oh my God, I can't even think about looking at it. You want me to touch it? There's a lot of reasons why we don't do simple, let's say, arm movements, Haley. You raise your arms. You don't have to touch your scar, but what this does is it takes, remember that fascia that was cut? You raise your arms, all of that's connected. It raises that fascia in your belly and it brings it down. So as that all the belly area is healing with all that scar tissue, when you move your arms, the scar tissue goes, oh shoot, Haley needs me to move. Oh, so I won't be so tight then. Okay. And this is not the same as, oh, I'm gonna have loose hanging abs if I move my arms. No, that's not what I mean by opposite of tight. What I mean by so tight that it's causing that shelf-like appearance. You don't want that sort of tightness. That's preventable. You just gotta move. You gotta belly breathe. And that's easy. You're already breathing. You might as well
Mhm.
take big belly breaths, pain-free, of course. Start that on day one. You're gonna walk. Because when you walk and you take a step, well, your one leg is behind, and that one leg gently stretches all your ab tissues, all that scar tissue, but from below. The same way if you raise your arms, it stretches your ab tissues from above. It's as simple as that. It is not even rocket science or even a best kept secret. It's so simple. Moms should be told this in the hospital. You could do this lying in your hospital bed.
Yeah.
You
So
don't even
it
get
does
up.
feel like a really good kept secret. Why aren't hospitals telling us to do this type of rehab?
Again, for a lot of reasons. The first one probably being it's not in a nurse's or a physician's wheelhouse. They're not being taught even in medical school or professional school about the rehabilitation after surgery.
Mm.
Shocking side note is I was talking to a family physician and she was saying the obstetricians who perform cesareans aren't surgeons. And I'm like, of course they are. They perform surgery. They're like, no, you don't understand. The training for a surgeon to do surgery is different from what obstetricians learn because doing a C-section is like the only surgery they would learn amongst a million other skills they have to learn to be an obstetrician, because they're dealing with any issue involving the gynecological area, not just a C-section surgery. So can you even imagine? They have to know about polyps and hysterectomies and a woman's gynecological everything from birth to death. And it's just not in their rehab or in their schooling. They're not learning about, here's how you rehab after surgery. So they're not learning that. So they probably don't even know. But Haley, maybe a better question is, I don't know that you need to learn to ask that question. Hey, you might want to do some rehab about it. I don't know how to do the rehab on it, but you might want to. And let me tell you, that alone would change the outcome of thousands of cesareans in North America. People listen to their doctors. If a doctor just said, go get rehab on this, it's a good idea, I think that alone would be helpful.
Yeah.
But it's not in their training.
And who are we going to? I imagine a pelvic floor physical therapist, a regular physical therapist that specializes in women's health, or maybe particularly C-section recovery and rehab. Who should we be seeking out care from if we are interested in seeking that out ourselves?
This is a great question, because I wish it was more organized to say, you should see a blank. And therefore, the same way as pelvic floor physiotherapy was not even a thing 12 years ago, and now it is, I think there's a real opportunity right now when folks like myself are talking about C-section rehab. 1 in 3 pregnancies result in a cesarean. Why aren't we talking about cesareans? I call myself a perinatal therapist. I should just call myself a C-section therapist. Either way, there's no such thing. But the point is, like, what do you call yourself if people don't even know what to ask for help? Honestly, people don't know they need pelvic floor therapy, but thank goodness we're talking more about it. But it's not a standard recommendation by most, obstetricians or whatever. But so in general, for myself, I'm a perinatal therapist, a therapist who works with moms in the whole time around pregnancy, giving birth. I just happen to focus almost exclusively on C-section rehabilitation. Pelvic floor physiotherapist, potentially, but here in Ontario, where I am, not all pelvic floor physiotherapists have the same education. So a physio can call themselves a pelvic floor physio if they take only one of 3 levels of pelvic floor therapy schooling and a postpartum education. So they may never get to the part where they talk about cesareans. They might have never seen a cesarean scar before. They might never know the first thing about manual therapy about it. So it's always good to ask. And certainly, let's not forget about our fitness instructors, our Pilates instructors. I can't even tell you the professionals that I work alongside who are so interested and so passionate are the folks who don't have the MD after their name and after the therapists. I think there is so much goodness out there. It's almost, do we ask for a personal trainer who's worked with a lot of cesarean moms? Granted, someone who's not a therapist technically can't massage your belly and assess you. But let me tell you, you don't need a therapist degree to show you how to lift your arms up and down.
Yeah.
And in my programs online, my gosh, it's just you press the video, follow along. Moms can do this themselves.
At home.
Oh my God, at home, 5 minutes a day.
During nap time.
Or even holding your baby. You can raise your one arm.
Okay.
You can raise the other arm. You can take belly breaths while nursing.
Yeah.
Feeding your baby. And yeah, you're right. Give the baby to someone else. Go for a walk. And there are other exercises. There are not many. But when folks ask me that question, who do we see? You know what I always say? I go, get on your mom Facebook group, because moms know everything. In Toronto, I'm part of the Wranglers here, and just like a private invite only Facebook group. And only cool moms are allowed in, which means folks who don't judge, folks who just are here to help, we're here to give. Come and vent. It's cool. And I think everybody needs a safe space like that. And it's very cool to go onto a space like that and say, hey, I just had a cesarean. Anybody got any recommendations? Just ask that. It doesn't even have to be, do you know of a therapist? Because, like I said, it could be your neighborhood Pilates instructor or a personal trainer, and they can know just as much, if not even more.
Then you're done.
Right? Like I said, I didn't learn this stuff in school. I spent
Yeah.
20 years putting this together myself.
Wow. Yeah. Okay, what about, I feel like we've talked about people who are immediately post-surgery and kind of immediately postpartum. What about listeners who are years postpartum and they have a shelf? Now, what are they doing? Because they're past the time of the swelling. They're past the time probably where compression wear would help, I would assume. So, what are
You're
those
right.
people doing?
You're right. So compression, we're done after like the 6 week mark. We're slowly
Okay.
weaning that off, like totally gone for the
Okay.
most part by 3 months, right? If you have an infection, it might be a little different. But that core retraining starts on day one because it lasts for the year. Like I'm just gonna give it to everyone real. You're not healed after the first 6 weeks. You're not healed after 6 months. You're not because you have an infant that prevents you from sleeping, which is actually the number one thing you need to heal. You can have the best therapist, pay all the money for the best everything program, whatever, and you will not heal if you're not sleeping. That's why it takes so long. For folks who had a hysterectomy or a myomectomy for fibroid removal, like who don't have an infant also, they heal much faster because they
Wow.
have the time. Okay. So I'm answering your question with the chronology of a person who has at least one infant, if not twins, if not also toddlers. Okay. It takes a year plus. It does. So for that C-section shelf, a big part of the cause of the first, let's call it first 6 months, tight scar tissue. You got to do scar massage.
Okay.
It is so easy to learn, okay, that you could do it yourself. I wish I could, if I've had organizers, I would show you all these pictures of every person that I've ever worked with, these crazy results. I've never even touched them. You should see their scars before and after. It's crazy what can be done with scar massage, self scar massage. Okay. So that's 2 to 6 months is the ideal time to be doing scar massage because the scar tissue, it's like putty. It wants to be molded. It's asking you, how tight should I be? What do you use your body for? Because I need to make sure you can use your body and I'm going to keep it from splitting open as you rock climb or 3 kids, or we're going like hiking now with the baby and the this and then the stroller and the that, or you're going back to marathon running or weightlifting, soccer, whatever. Your scar tissue saying, what is my command? And if you don't give it any input, it just goes as tight as it can, given how much activity you may or may not be doing. And most often, it's not a lot of activity. So it really invaginates. That shelf really gets accentuated because of the tight scar.
Really deeply is what you mean. It's a deep
Yeah.
issue.
Yeah. It doesn't have to be deep. It could be stubborn. It could be like, it could be tight. So it's still tucked in,
Mm.
even if you lose weight, even if you go back to
Uh,
working out, etc. Because the tissue itself is tucked in. It's stuck down. It's stuck down. And then concurrently, you want to strengthen. So the strengthening opportunity is forever. Okay?
okay.
That C-section shelf can be caused even years out because of loose muscles. So it
Weakness.
hangs.
Yeah.
Weakness. Yeah,
Mhm.
lack of tone or whatever
Okay.
folks want to call it. Because don't forget that shelf-like appearance isn't just the tight scar tissue, it's what kind of might bulge over the top. And if what's bulging over the top is loose skin, exercise may not help with that. Extra fat, depends how your diet is, your stress levels, your hormonal changes, whether or not you're nursing, all those kinds of things. Exercise may not help with that. But if it's from loose muscles, because they're weak, girlfriend, let's put you on a core rehabilitation program. There's no limit to that. Your muscles are always ready to learn. They're always ready to learn.
Yeah. Okay, so
Okay.
you mentioned scar massage. What are your feelings about lymphatic drainage? Because as you were talking about the swelling and just like stagnation of fluid, what came to
Mm-hmm.
my mind, and you had mentioned the physical kind of massage of moving things through, my mind went
Yes.
to lymphatic drainage. Is that something that you
Okay.
might see benefit from?
100%. So lymphatic drainage helps with swelling. So folks, if you're thinking, what is HeHe talking about? Lymph nodes pick up swelling in your system and cycles it out, pumps it out. So lymphatic massage is a very fancy term. I'm going to show everybody. For this, I'm basically playing the piano on my skin and even over my pants. So folks, do this day one. First
Oh,
6 weeks. So in my programs, I teach folks to do their own lymphatic drainage. I don't call it that. I maybe should. Maybe folks are searching lymphatic drainage, but it helps with swelling. And it teaches you to just slowly get comfortable touching your own body again. So you could do this technique over your pants. You don't have to get right on the incisions because maybe it is black and blue and you are afraid of touching it and getting it infected. That's okay. You don't have to touch it, but very light. And HeHe can see I'm not even, there is no fingertip imprint. I am so surface level. And it almost feels like I'm doing nothing, but it helps a ton with swelling. And I'm going down to my lymph nodes in my groin, right? And I'm going definitely over the surgical area, out to my hips, up to the top. Don't forget, you got abs up here too. Just for a minute.
yeah. That's
Helps
so
like
helpful.
crazy.
Yeah.
But again, when the swelling's gone, lymphatic drainage doesn't work anymore. You don't need it anymore.
Okay. So just
Massage
for those
then,
immediate weeks.
yes, absolutely. Immediate weeks, first 6 weeks for sure. And
Okay.
then if this was my belly, you're going to start to do what people think of when they think of massage. Am I really going to rub my tummy like this? Yeah, girl. Yeah,
Okay.
you are for sure. And there's a whole protocol for that, right? So you wouldn't
Okay.
start with this. This makes people cringe. Oh my God, that's going to hurt. Yeah, it's going to hurt if you miss the first few steps. So it's progressive. Essentially, I would teach you to be your own massage therapist. It's not complicated, but it's not easy.
Mm.
You're not sleeping. You got crying baby. You got to feed. You got to wash bottles. You got to wrangle children potentially. So it's very important. A C-section shelf. Is it ever too late? The answer is no. But you gotta. The most important ask is for that time, that protected time. Who are your support people who are going to ensure that, hey, HeHe gets not just 5 minutes for her C-section rehab. By the way, 5 minutes is all you need for the first few weeks. It makes a huge difference. But if you had more time, of course you'd have more results. Of course you would. Just like when we started at the beginning, you put $5 in the bank every day. Of course you're going to have money at the end of the year. You put in $10, you're going to have even more money, right? It's impossible not to have results. So, again, you can't do it without help. You need someone else to still give you that space, that mental space, and the time to focus on the most important thing right now, which is your own health.
Yeah. And I want to take some time here, you guys, for people listening that have had traumatic births and are feeling that mental and emotional resistance to being connected to your scar and connecting to your scar physically and emotionally. That can be really hard. So give yourself grace if you feel like mental health support is a good thing for you to explore. I want to encourage you to do that. A lot of trauma comes from C-sections, and that can really be something that is almost like a roadblock in our recovery. So, if you need to
Mhm.
start there before you start with the physicality of recovery, don't be afraid to do that. If you can do them simultaneously alongside each other, I think it's very clear from this conversation that you'll probably get the best benefits from that. But I do know that the trauma that comes from a cesarean birth can really just be so life altering, and it can really change the way that you view and feel about your body in such a deep way that maybe even thinking about doing scar massage or thinking about that very gentle touch of lymphatic drainage on your own body can almost be re-traumatizing. So I want to pull you back into this conversation and say, if that's too much, you don't have to start there. You start wherever it feels comfortable to you and work your way to a place that also feels comfortable to you.
Thank you for shouting that out. It is a very unique sort of injury. Anytime
Trauma.
you have an unexpected injury
Yeah.
and you add sleep deprivation to it, and you add first time mom, and you add now I no longer can be identify as an athlete or what have you, there are so many emotional loads there, right there. Forget about, oh, now I have to rehab. No, thank you for highlighting that, Haley. It's not, I have the easy job of just being the physical therapist, but we can't heal physically without the mental piece, whether you're from a pro athlete or not an athlete at all. Your mind and your body are inextricably linked.
Yeah, they're one. They really are. Okay, I have one last question before we wrap up. And in the beginning of the episode, you talked about sutures and dissolvable stitches and glue, and that there are many ways that we will be able to close your cesarean surgical site, and that this is largely up to the surgeon. But one thing I heard in that is that since there are options, that means you have options. And so if you know about what the different options are and you feel
Mm.
more aligned to one, you might be able to take it to your surgeon and your OB and say, if I need a C-section or because I'm having a C-section, I have a preference for this type of closure. Do we have any data that shows that certain types of closures are either more beneficial or not as beneficial when it comes to healing and possibly the rates of C-section shelves?
What I can say is that there are pros and cons to all the types of closures,
Okay.
which is why there are so many. Do you
Okay.
have an allergy to one and not another? Are you someone who moves a lot? For example, staples are more secure. They also come out at 4 days. Can you believe that? 4 days after
Wow.
surgery, you have nothing holding it together. Anyways, so staples are more solid, but a lot of folks literally couldn't even think of seeing that. And that alone may be so traumatizing. They're like, no, thank you. Stitches, please. Dissolvable ones. I don't even want you to come and take them out physically. I want to. So there's pros and cons to everything. One isn't going to get you a better incidence of not infection versus another. That's something else, right? I'm sure it matters on the climate as well. You and I are in areas where it could be so cold, you're layering on every single piece of clothing. And in some parts of this world, it's so hot that who knows? I don't know what closures wouldn't work when it's 30 degrees plus every single day. So I'm sure like there are a lot of things to weigh. And I think the best way to be informed and make a decision is to speak to your particular provider ahead of surgery.
Yeah, great answer. Cool. Oh my gosh, this has been so informative. All right, one thing that you have going on currently, which I think a lot of people will be really interested in hearing about and joining, is your C Summit. Tell us about that.
C Summit meaning C-section summit in celebration of April, which is Cesarean Awareness Month. This is April 23rd now when folks are listening to this.
Yeah.
So I had live classes all last week and coming up for this following week, actually today, which is the 23rd, we will be having two more live classes to teach folks how to do scar massage, like in real
Wow.
time. So that's what I'm personally doing. But also, there are expert interviews. Like if you sign on, you have access to all kinds of interviews with folks who talk about nutrition after C-section, Pilates after C-section, pelvic floor after C-section. Oh my gosh, mental health with psychologists. I interviewed psychologists for C-sections. A lot of things are so important, but it's not my wheelhouse. And so I was able to get some folks on the C Summit to speak to that. And last but not least, mom stories, C-section mom stories. To moms who have gone through cesarean, it doesn't matter if it's been one day or like 20 years. Sometimes no one's ever asked us how that was. How was that for you? If you've never had a chance to talk about your story or see it reflected anywhere else, I think sometimes we carry an amount of shame or guilt or sadness, just anger that we don't even know we're doing until we hear that story. And I have 4 or 5 really brave, courageous moms who came on and shared their stories in hopes of just to help other folks feel seen and heard. So those are there
Love that
too.
so much. Oh my goodness, that is amazing. Okay, Janette, thank you so much for being here. If people were interested in learning more from you, connecting with you, maybe even seeking out your services, either online, virtually, or in person, if they're in the Ontario area, where can they do that?
I'm always on the gram. I think you and I are always on Instagram. So
I
ask
live there.
Janette. I know I live there, whether or not, for better or for worse, Instagram and TikTok is Ask Janette. My website will have all my course information and tons of free resources. That's JanetteYee.com. And right now, sign up for C Summit. Everything's recorded. So if even you can't come live, sign up because you're going to get such great information. And that link is, I think, just down in the caption.
Yeah, absolutely. And as always, you guys, we'll link all of these resources for you in the show notes. Janette, thank you so much for being here today. I know that if you're walking around with a C-section shelf, you probably have a lot of big feelings connected to your experience of having a C-section and the way that your body has healed after that C-section. I want to remind you that you can do something about that. So if you're ready to take action to get rid of that shelf, today's episode was a wonderful resource. Janette is a wonderful resource, and it all starts with you. So you're not alone. I want to empower you to take those action steps and find a place that you feel happier and stronger and healthier in your body. All right, you guys, I'll see you in the next episode. Be sure to follow Janette on social media, and you can find me at Tranquility by HeHe and at The Birth Lounge at the.birth.lounge on Instagram. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.